It seems like lots of different people are on medication today for a variety of different psychological issues. So some people are on antidepressant medication, some people on anti-anxiety medication. So how do you know if medication is right for you? And if medication really works? Do you need to be on medication and be in therapy at the same time? Hi, I'm Dr. Lori Barker, and I am a therapist, an educator, and a consultant. And I love sharing information with people to help improve their mental health and to just live their best lives. So in this video, I want to cover the topic of how do you know if medication is right for you. I'm really not going to cover the different types of medications. That's for another video that I'll make and post in the future. But for right now, I just want to help people sort of think through that decision about whether what we call psychotropic medication, meaning medication for psychological issues or for mental disorders, making that decision about whether that is right for you. So what I usually say to my clients is that there are three different types of people when it comes to psychotropic medications. So the first type of person is somebody who maybe is just really going through a stressful time, a rough time, and they need that medication to help give them a boost, give them some assistance. It's like a tool to help them through that rough time. And once they get through that rough time, then they probably don't ever need to be on medication again. So that's the first type of person. The second type of person is the person who maybe does have some sort of more long-term psychological issue that, maybe the research shows that's something that is more genetic or more biological, more physiological. So meaning this is something that the person is likely going to struggle with it for the long term. Maybe not for the rest of their lives, but maybe it is. That might be the kind of person who needs to be on medication indefinitely in order for them to have a quality life. And then the third type of person is the person who may be somewhere in the middle. So sometimes people know that there's a difficult period that they have. So meaning they know there's a certain time of the year, a certain season, or certain events that happen that trigger their psychological symptoms or when their psychological symptoms get worse. So for example, that might be during the holidays. And some people know that the holidays are a rough time and they tend to get more depressed or more anxious during the holidays. Or maybe for some people, it's the anniversary of something. Maybe it's the anniversary of a loved one or some other traumatic event. And they know that when that anniversary is coming up, they have a tough time. Meaning they tend to get more anxious or to get more depressed. So at those times, maybe the person anticipates and they know, hey, this is a rough time of year for me, or I know when this certain event happens that it's rough for me, and I need to take medication to help me through that, prescribed period of time. So that's how we work with that person, right? That maybe if it's the person where the holidays are rough, that they go on the medication a little bit before the holidays come, and they stay on it until a little bit after the holidays are over, and then maybe the rest of the year they don't need it. So let's review real quick. The first type of person may be the person who only needs medication once. They go through some type of event or some situation where they need a little bit of help. They need the extra boost from the medication to get them through that one-time event. They take the medication and maybe they never need it again. The second type of person is the one who has maybe more of a chronic mental disorder, something that's more long-term, and in order to manage their symptoms, in order to have a quality life, that might be someone who needs to be on medication indefinitely for a long period of time. And then we said the third type of person is the one that maybe just needs medication periodically, when they know there's certain events or certain times of the year that are hard for them, and they take medication during that time, and then they don't take it the rest of the year. So 3 main types. Now the challenge is we don't know which type of person you might be in the beginning. So let's say you come to me, I'm your therapist, and you say, Dr. Lori, I'm wondering if medication might help me. And I would give that person this same talk that I'm giving in this video now, and I would let them know, the problem is, or the challenge is, we don't necessarily know which type of person you are in the beginning. So it might take some trial and error in order for us to figure that out, right? So that's one of the challenges with getting started on psychotropic medications. We don't always know which way it's going to go, and it can take some time to figure that out. It can also take time to figure out which type of medication is the right type of medication for you and for your particular symptoms. Again, in this video, I'm not going to go through the different types of medication. I will do that, so look for that in a future video. It can take time to figure out what dosage is the right dosage for you. And it's hard. It's hard when you're suffering, when you're struggling, and you're hoping the medication is going to help, and it doesn't right away. It may not right away. It may take some time to play around with different medications, experiment with different dosages to get the one that is right for you. And that brings up my next point, that ideally it should be a psychiatrist who prescribes your medications. Now, I'm a clinical psychologist. I have a PhD, and in most states in the country, I do not have what we call prescription privileges. Only a psychiatrist can prescribe psychotropic medications. Your general practitioner, meaning your primary care doctor, can also prescribe psychotropic medications. And in fact, that is where most people, and I don't have the statistics on this at the tip of my tongue, but most people, from my experience, from what I know, get their psychotropic medications from their primary care doctor. And that's for a number of reasons. One is affordability, right? It can be more affordable to get it from your primary care physician because psychiatrists are specialists, and maybe it costs a little bit more to go and see a psychiatrist. That can also be because of your insurance plan. Sometimes insurance plans want you to see your primary care physician first and then get a referral to a psychiatrist. And that can take a long time. That can be a cumbersome process. So sometimes it's just easier for the primary care doctor to prescribe the psychotropic medications. But here's my Dr. Lori advice. If possible, if you can afford it, or if it's possible through your insurance plan to get the referral to the psychiatrist, I strongly recommend that because the psychiatrist is the specialist. The psychiatrist went through medical school, just like your primary care physician, but after medical school, in their internship and their residency, they specialize in psychiatry, where your primary care physician does not. So it's the specialist, right? Like if you need to have surgery, do you want your primary care physician performing surgery on you? Probably not. Or if you need glasses, do you want your primary care physician examining your eyes and figuring out what glasses you need? No. You go to the specialist. You go to the doctor who receives special training, special certification in that area. And the same is true with psychological issues. You want to go to the person who's had years of specialized training. They're more familiar with the medications. They're more familiar with all the side effects that can occur. They know more about how those medications may mix with other medications. So it's, again, ideally, I understand that not everyone is able to do this, but if possible, I strongly recommend going to a psychiatrist for your medications. The other point I want to make about this is that the research shows the most effective treatment is the combination of medication and therapy, right? For certain problems, right? If it's a problem where medication can help you, medication alone is not solving the problem. Like you may hear people, you may even hear some doctors say, oh, these psychotropic medications, these antidepressants, they're going to change your brain chemistry and they're going to cure your depression. Well, I hate to burst that bubble, but that is actually not true. It's not going to cure you of your depression. It's helping with the symptoms, but it's not really giving you tools to help you know how to manage your depression without medication or even in combination with the medication. So again, this is supported by research. Let's say it's someone who suffers from major depressive disorder, someone who's very depressed. Yes, antidepressant medication can help that person, but really it's the medication plus the therapy. Because what does the therapy do? The therapy helps that person understand their depression more, and it helps give them tools for learning how to manage their depression, right? How to hopefully over time lessen their depression or decrease the intensity of it, the frequency of it. So again, one of my Dr. Lori recommendations is to not take medication alone, but to always take medication in combination with the therapy. Another point that I'd like to make about medication is how should we view, as I just mentioned, it's not really a cure. Yes, it can help decrease symptoms, help people manage symptoms, but I can't even remember where exactly I heard this, so whoever told me this, I give you credit. This isn't original with me, but it's something that I found very useful in explaining to my clients, again, sort of what's the most effective way to use medication and to think about psychotropic medications. And that is the idea of thinking of medication like a cast, right? Like what if you break your arm? Say you're being ambitious and you're going roller skating at the beach and you fall and you break your arm. They take you to the ER, they do the x-ray and they see that your arm is broken. And then what are they going to do? They're going to put your arm in a cast. And what does that cast do? That cast on your broken arm helps to provide the environment so that your arm can heal. And that's a way that I think is helpful to think about medication, that medication is like the cast. Medication helps provide that environment to help you heal. For example, if someone is suffering from major depressive disorder and they're so severely depressed that they cannot get out of bed, they cannot function, they're not able to go to work, or if they can go to work, they're not being effective there, they can't go to school, they're isolating themselves from their relationships. So the depression is really negatively impacting their life. So what we may want to do is put that person on antidepressant medication, because what the medication will do is hopefully help lift that person's mood to the point where it will help facilitate healing. And this is where the combination with therapy is really useful, right? So that medication may boost the person's mood to that point where they can benefit from therapy, right? Because if that person's so depressed they can't even get out of bed, they're not going to make it to their therapy appointments, right? Even if it's teletherapy, they may be so, they may be so fatigued and not have the energy or the motivation, they can't even turn on the computer, to log in for their teletherapy session. So what is medication going to do? It's going to boost their mood to the point that they have a little bit more energy. They have a little bit more motivation, so they can make it to their therapy sessions and then work with their therapy on the other tools, the other strategies that will help decrease their depression. So the main message, one of the main messages here in this video is, yes, medication can be helpful. So you need to have that conversation with your therapist hopefully get a referral to a psychiatrist, have that conversation with a psychiatrist, have that psychiatrist do a medication evaluation with you. They will do an assessment. They will diagnose you if a diagnosis is needed. They will figure out what medication they think is most helpful. It may take some time to play around with different medications, play around with different dosages, but in the end, hopefully that medication is just one tool in your toolbox to help you improve your mental health and live your best life. I hope that this information has been helpful on your mental health journey. Stick with me. If you liked this video, click the like button. If you want to see more videos like this, learn more information, subscribe to my channel so you can be notified. Click that notification bell so you can be notified when I post more videos. Go on my channel, take a look, see what other videos look interesting, and let's continue on this journey together to improving your mental health and living your best life.